Hey FIGS, this is Devin Forte, and I'm going to be a registered nurse hopefully sometime next year. Where am I from? I'm from North New Jersey, and I work at Morristown Medical Center as a nursing assistant. It's the best job I've ever had and the most applicable to my field. Um, I have a great team that I work with there, and our patient population is geriatrics, and I just love working with them. They're pretty hysterical, if you can imagine. Um, I'm currently enrolled at Seton Hall University in their accelerated second degree BSN program. It's kind of a mouthful, as is the program. I'm currently in 6 classes and 3 labs and 1 clinical, so it's kind of a lot going on. My day to day is very busy all the time. Um, I rarely have a break, and when I do have that break, I'm usually working. My first degree is from Monmouth University in West Long Branch, New Jersey, and it was in health sciences. I chose a career in healthcare because of my aunt. She passed away a few years ago from metastatic breast cancer, and it was pretty devastating to my family and I. And she was always that person that you could go to, and she would be there in the drop of a hat. Um, that is the impact that I want to make on my community, is that I want to be that person for other people. I want to be that confidant. I want to be that compassionate and caring person that patients go to when they're in need and they're vulnerable, because that's the biggest part of all of this in healthcare, right? Is vulnerability. Patients are vulnerable, they don't know what to do. That's why sometimes they lash out or do this or do that. And the most important thing to understand is why they're doing that. Are they in pain? Are they doing this? And be that person to talk to them and know that they can trust you. And that's what it means to be a nurse to me. The impact I want to make on healthcare in general is to have higher patient to staff ratios. I think overall we would have better teamwork ethic, and we would have better patient responses, better patient outcomes, less human error, less med errors. The impact in 5 years, hopefully I want to be a nursing educator of some sort at a university or even in the hospital. And in 15 years, I definitely want to be a chief nursing officer of a hospital or hospital system. I have a lot of great ideas and a very creative person, and that's what I bring to the table, and that's what I want to change in healthcare for the better. What inspires me is my aunt. She always keeps me going, and I actually have a pineapple tattoo on my arm from her. Not from her, but it's for her. And she just loves pineapples, and it's just a joke me and my mom have, and that's what me and my mom both have pineapple tattoos. Go to Pump Pump song, Rain on Me, Ariana Grande, Lady Gaga. Best song ever. Tell us something surprising about why I chose this path. That's my aunt. Yeah. How do you take your coffee? Oat milk with agave. What's one piece of advice that's been invaluable to you in your life? That would be to listen to people. You can always tell by word choice or tone what someone's trying to say, what they're trying to not say, or how they feel, or you get it. They the most important thing is to listen to people. People speak because they want to be heard. Having an open ear, especially in healthcare, is just the best skill that you can take with you anywhere, in any job, any relationship, anywhere. Communication and listening. Um, how I got here? Well, I went to high school, then I went to Monmouth for my health sciences degree. I studied abroad for a semester. That was pretty interesting. That was also prior to COVID, so I did have a full experience. It was absolutely breathtaking. I went to Florence, Italy for 4 months. Um, Financial strain affecting my journey. It's definitely been a lot. My dad lost his job a year ago, so that's been really tough on my family and I. Things are starting to look pretty south for us. Um, I'm trying to help work and pay for my expenses now. I currently have like $90,000 in loans. That's aside from the program that I'm currently in now. I know that the new Icon grant will really help me with that. So thank you, Figs, for the consideration. And I'm a huge fan, so don't stop making scrubs. Thank you guys. Bye bye.